Hi, Tristan. I'm Greg Johnson. Happy
Nice
to meet you.
Just
Welcome to
a
our
little-
office.
Good to be here.
Yeah. Come on back here. I'm going to watch you walk back. My exam starts here. You can have a seat on this black table over here by the window. We're going to get a history and do an examination on you first, just so I can see if I'm going to accept you as a patient today or not. So Tristan, if you had a laundry list of all your complaints, beginning with what you feel, not what other doctors have told you, but what you feel is your primary complaint or the thing that bothers you the most, what would that be?
I'd say low back pain.
Is it above your belt or below your belt?
Right at my belt line
Okay.
on the right, primarily.
Okay. Does it ever go down your leg?
It used to.
Has it ever gone down your leg?
Yes.
The right one?
Yep.
Okay. How far down did it go when you had it?
Outside of my calf.
Into your calf? Did it go into your feet ever?
Nope.
Okay. How would you rate your low back pain today as we're sitting here?
2.
What's the worst though it's ever felt?
10 because I was getting
You're
morphine.
in the hospital
Yeah.
morphine? Okay.
Epidural steroid injection.
Yeah, and I always explain the scale to them right off the
Yeah,
bat.
10
because-
being.
Yeah. 10 being that show bad you're in the hospital getting morphine IV.
Yep.
And say those words, morphine IV, because they think a pill is morphine sometimes too, and it's not.
No.
Or a shot.
Yep.
Cortisone shot even. It's right leg pain to right calf. Do you have any right leg pain at all right now?
0.
What's the worst that got when you had that?
Probably 6 or 7.
Okay. Now let's try again the top number.
Yep.
What's next on your list?
I guess I get a little bit of mid-back pain here.
Okay, we're gonna call that T-spine. Does it go into your upper back sometimes too?
A
To
little
your shoulder
bit.
blades?
Yeah, a
Okay.
little bit tight.
So I'll put T-spine, mid-thoracic, upper thoracic, lower thoracic. Do you have any tightness in your thoracic spine today?
Probably like a 1.
Okay, what's the worst that's ever felt?
4.
Okay. Has it ever traveled around your ribs on either side, or if it's your sternum on either side, or your clavicles?
Nope.
Okay, what's next on your list?
A little bit of neck pain.
Okay,
Little
is
pain.
it worse on one side than it is the other?
Probably on the right.
Does it ever go down your right arm or into your hand? Okay. How would you rate your neck pain today on a 0 to 10 scale as we're sitting here? And always say as we're sitting here, that
As we're-
because that, yeah, because that gives you the right now.
Yeah. 1 again.
Okay,
Just
what's the
noticed.
worst pain you've ever had in your neck?
Again, 4.
Okay.
Just tight.
Do you ever get headaches?
No.
Do you ever get dizzy?
No.
You ever lose your balance?
No.
No?
Not unless it's alcohol induced.
Okay, yeah, that doesn't count. Yeah, any other
Had this
issues
for a while.
going on? Shoulders, elbows, wrists, hips, knees,
A
ankles?
little bit of right knee
Okay,
on occasion. I did break this femur.
the right femur?
Mm-hmm.
Do you have any right knee pain today as we're sitting here?
No. 0.
And what's the worst that's ever felt when you had that happen?
10,
10
when I
in
broke the
hospital.
femur. Yeah.
And when was that fractured femur?
That would have been October of 2013.
Okay.
2012, 2013.
Were you hospitalized? Just ER?
No, not even ER, because they didn't know it was broken at the time.
Oh, really?
Yeah.
What
they
did you do for it? To cast it?
No, I went home for the weekend and laid in bed, and then went back on Monday for an MRI. 3 days later.
Did they do anything treatment-wise then?
No, I just had ice.
So you never had a cast?
Mm-mm.
So it wasn't displaced then?
No.
The fracture?
No,
Was it
not displaced.
like a hairline or a
It was
spiral or
an avulsion fracture.
an avulsion fracture?
Yeah, the medial epicondyle.
See, I write that down too. And that's when you started getting right knee pain?
Yeah. I also tore my right ACL at the same time. Same injury from football.
That was 10 and 13 as well, same
Yes.
injury?
Yep, same injury. And then I tore my MCL in this knee 2 years after.
On the right knee again?
Yeah, right knee
Wow.
again. In 2014.
Do you have that surgically corrected?
Nope.
No. Okay.
The only surgeries were the femur repair, and then
ACL repair.
6 weeks later they went and took the screws out and then repaired the ACL at that time.
Okay. Any other surgeries or hospitalizations?
I had 2 epidural steroid injections
When was
for my
that?
low back. 2016, mid 2016, June.
Okay. And when was the other one?
8 weeks after.
Okay, so
Yeah,
July.
they were pretty much back to back.
Did they help?
No.
Okay. Any other medical procedures?
Not that I can think of. Wisdom teeth.
Okay, yeah, I don't put anything down about
Yeah.
that. Have you ever been involved in any accidents or had any injuries to your spine,
Not
ever,
really.
besides football?
Just football.
A repetitive football
Bunch of
stuff?
bunch of micro trauma.
Mm-hmm.
Macro trauma too.
Mm-hmm.
Playing football.
No car accidents or falls or anything? Okay. Have you ever been diagnosed with any medical conditions such as heart disease, cancer, diabetes, high blood pressure, atherosclerosis, TIA?
I was hypertensive for a little while, but I never took medication for it, and it was never diagnosed actually
Okay.
either.
Okay.
But it was when I was 300 pounds for football.
Oh, okay. High
But
blood pressure.
it's gone down
Your
since then.
BP's fine here today, by the
Yeah,
way.
it would
If you
be.
took it. Okay. Have you been adjusted before, Tristan?
Yep.
When's the last time you got a chiropractic adjustment?
Last week.
Okay. For these same issues?
Yeah.
Did it help?
Yeah.
Okay, good. And I always put that down there too. Why did I put that down? That's a CYA thing too.
Gotcha. What is
Because-
this? CYA?
Cover your ass.
Oh, okay. I was trying to think of chiropractic.
Yeah.
Agency.
Yeah.
Okay.
And the reason I asked that is because if they just saw a chiropractor last week
Yeah.
and they did a lumbar roll on them
Mhm.
and they get an adjustment here and I don't do the lumbar roll on them, but they say they have more pain afterwards.
They're gonna think it's from you, not from.
Right, but you documented here
Yeah, that they got.
an adjustment last week, so they can't really pin that injury on you or that pain, in other words, because some people will try to.
Oh, yeah.
I treat every patient as if they were a lawsuit
Absolutely.
right up front. That's why I haven't been sued in 41 years.
Yep.
So if you do a thorough job in your history and your examination, you won't have any problems getting through the career without having a malpractice suit.
Yes, sir.
And that's the reason I'm so detailed on all this stuff too, is to avoid
Yep.
potential situations as well. Is there any other issues that you're dealing with now or have had in the past that we haven't discussed at this point in time?
Not that I can think of.
Okay. Have you ever lost control of your bladder bowel functions?
Nope.
Have you ever not been able to stand on your tiptoes or your heels or walk correctly?
No.
Okay. Have you ever had numbness or tingling sensations in your face or your head? Have you ever had drooping muscles on either side of your face? So what am I checking for with those 4 questions?
Pathological.
That's right, pathology. So then I write down here, no loss of bladder and or bowel function, nor foot drop. Because some people have had drooping muscles on one side of their face, and that could be Bell's palsy
My sister.
or trigeminal neuralgia can cause pain on one side of the face sometimes too.
My sister had Bell's palsy when she was.
But you have to be able to differentiate Bell's palsy from stroke.
Bell's palsy is gonna be the entire face. Stroke is gonna be just the bottom.
Can be, but I mean,
Typically, that's what we learned. is that
and that's mostly true, but I've seen
stroke
Bell's
spares the
palsy.
forehead along a lot of the times, so they'll be able to.
Yeah,
raise
and
it.
most people
Eyebrows.
have acute headaches or acute dizziness
Yeah.
are warning signs of stroke patients.
Yeah.
But that's acute.
Yeah.
Chronic headaches and chronic dizziness doesn't.
Yeah.
You just want to rule that out with these questions.
Yep.
Okay, so if that's everything that you have going on and that's all of your medical history, is there any other medical history that you've had done by a chiropractor or an MD that we haven't talked about?
No.
Okay, so what I'm gonna do next then, Tristan, is called an orthopedic neurological exam. I'm gonna check your entire spine and pelvis out and nervous system, we'll just go from there.
Do you?
So I'm gonna go ahead and run you through that too. First thing I do is just a straight compression. Does that cause any pain or discomfort anywhere?
No.
And then I go directly into the maximum foramen compression. Feel that one?
Yeah.
And then the right side there?
Yeah.
How about we go back and left and down?
Oh, yeah, right side.
Same spot?
Yeah.
So you see, I put a pretty good deal of pressure on that too, actually.
Yep. That's
Yep.
for sleeping on that RV bed.
That's right. Does that tighten up in here at all?
A little bit.
Okay.
More so. on
This side worse?
Yeah.
Okay, this, I'm gonna lift straight up on your skull. Does that feel better, same, or worse to your spine?
A lot better.
Okay. You're gonna love me then. I'm gonna push down, resist. Resist. You know why I tell them that? Gets them over their fear
Oh, yeah.
of the ring dinger.
Yeah.
Because a lot of people are apprehensive
a lot
on
of
that first visit too, yep. Now check the biceps, brachioradialis, and triceps reflexes. I don't do biceps and triceps muscle testing unless they have ridiculous phenomena going on. The good news is you're still kicking before I even do anything, Tristan. That's good, okay. So far so good. Let's have you stand up, face the mirror for me. I'm gonna evaluate your posture right now on the XYZ axes. So I'd like for you to close your eyes and bend your head forward and backwards and then back to neutral with your eyes closed. You're a side sleeper most of the time, it looks like.
I feel like I'm rotating.
You are. That's why I knew that. Plus you're over to the right too. Your pelvis shifted a little left today too. You have less room over here than you do over here, yeah.
Making an S.
All right, next thing we're gonna do is palpate your entire pelvis and spine, see where you have subluxations. Let's have you lay on your stomach here. Always talk subluxation with the patient.
Oh, yeah. That's what we diagnosed here.
Mm-hmm. Right leg's coming up short about 1/4 of an inch in this position. And when I bring your legs up, however, it gets even. Does that tighten up a little bit in your low back? On that right side there? Yep. See, that correlates with your right SI joint, which is what that tells me. A little bit right there. A little bit there even too. Some right here too. L5. L goes all the way up into your lower thoracic here on this right side. Right there too.
All that hay.
Mm-hmm. So that's, you've been doing that all weekend?
Yeah, and cutting limbs. And
Did it feel worse over the weekend? I mean, did it get worse as the
yeah, it
time went
didn't,
along?
it didn't feel bad when I was actually hauling hay. It was
Right,
probably,
afterwards?
yeah, it was really from that RV bed.
Okay.
I didn't sleep very well.
Next out there too. Lock this right leg straight for me, please, Tristan. Lift your entire right leg up in the air for me. Does that cause any tightness or pain in your back?
No, it
Or
just feels,
cramped anywhere?
no, it just feels difficult.
Okay, do this side now. How about this side comparatively?
That was easy.
Okay, so I always do my report of findings directly after my orthopedic neurological exam. So after I did my history and examination on you today, Tristan, you've got definite subluxations in your pelvis, primarily this right sacroiliac joint and sacrum, lumbar spine, thoracic spine, and rib cage. You've got a couple up here in your cervical spine too. So I can adjust you today for the first time if you'd like to get your first adjustment here.
Yes, sir.
All right, I'm gonna start off with your pelvis. Yeah. Yep. Some of these will be a little sore at first because they've been out for a while. They'll feel better after I adjust them. There you go. Yes, sir. Just recheck your legs here, see what you're looking like now. Perfectly even. Does this feel any easier to you this time, Tristan?
Yes, sir.
Okay, good. So that tells me we got your pelvic alignment fixed. What do you train the patient right there to do?
In terms of the leg check,
Yeah, and the knuckles test.
were you training the patient?
What are we training the patients to know?
Objective.
That we do objective, pre and post findings, that they can
Also feel the.
literally feel the difference. Okay, let's turn on your back now. Bring your whole head up and over your spine. This one. Now put both arms straight out to the sides, palms facing up. I'm going to adjust your shoulders, your clavicles, and your anterior ribs here. Yep, you can relax your hands on your stomach for a moment. Let this right leg go like a limp rag. There we go. Should have felt that from your knee all the way up to your lower back, did you?
Sure.
That's perfect. You feel that one too? Mm-hmm. Okay, let's sit you and face that away. Now that's a real Palmer shirt right there.
Mm-hmm.
Palmer's purple.
Yes, sir.
There it is.
And some new shoes too.
No, good. I got some old ones.
I was needing some.
They're old man shoes.
I hadn't gotten new shoes in about a year and a half. Do you find that people who crack their own knuckles don't get as many cavitations during them?
Sometimes.
Because like my sister and I, like even doing it to myself, I
Yeah.
hardly get cavitations, and on her. And
Yeah.
we sit there and crack our knuckles all day. That's probably why.
Do them backwards too,
Usually, yeah.
because they can stiffen up and protect your hands,
No, I know.
because
I-
you're going to be using those your entire
My
career.
thumb ones, I don't do like.
Yeah, I wouldn't really keep all that up. Well, on this adjustment, Tristan, I'm going to decompress your entire spine from your skull all the way down to your pelvis. When you explain things to the patient as you're doing them, makes it feel more comfortable for them.
Absolutely.
So I'm gonna use these big old pins to lock your pelvis in, so I can get a good decompression adjustment on the y-axis on you from your skull all the way down to your pelvis. It's gonna feel tight, but it's supposed to.
Yes, sir.
There we go. Yes, sir. Alright. Okay, on this one, you just want to keep your teeth together. Don't bite your tongue, breathe through your nose. Yes, sir. How far down did you feel that one today?
All the way down.
Oh, good. And looky there, you're good kicking. Tilt left. Tilt right. And if I don't get them, I don't go for them.
No,
Third time.
No.
You don't want to force them.
Yep.
So when you get off of this table, I want you to turn sideways, bring your legs over, and there we go, perfect, good. Now we're gonna stand here in front of the mirror, and I'm gonna use this instrument to bounce the muscle spindles to relax your paraspinals. Backwards, and then normal. Look in the mirror already at your head. See, that's straightened up more than it was at first. Show the patient all along the way what you're doing.
Oh yeah. I think that's one thing that Palmer clinics don't do enough of is, like, yeah, we do histories and exams, but
Well, you got to affirm and educate them on seeing pre and post adjustment differences too.
oh,
Did
yeah.
that feel easier that time? Well, you squared off like a military man right now. Your ears back here over your shoulders now.
Pelvis is center.
How would you rate your low back pain right now, Tristan?
0.
How about left leg, or right leg, I mean, still good there?
Yeah.
Upper back, mid back,
0.
neck pain,
0. It's all 0.
knee pain? Okay. Always just ask them now.
Yeah.
What's that doing? It's reinforcing everything you just done.
Yep. And showing them that you're tracking.
And
all that.
this is med legal. When you have the patient's initial before and
Setting
after,
that's their
that locks
numbers.
them into those numbers.
Yeah, absolutely.
And that way they can't come back 2 weeks later and say, well, I
Say,
felt worse after
Yeah,
that
your
adjustment.
numbers here that you initial.
Right.
Okay.
Is that you good on that?
So you're gonna be sore for about 72 hours after your first adjustment, kind of like you went and worked out real hard for the first time. When you get sore, put crushed ice in a freezer baggie directly on the skin over the sore spots. When you leave here, if you'll do a 10-minute fast brisk walk around the floor, 5 minutes each direction for as fast as you can walk, letting your arms move freely, we can retrain your brain how to hold your spine in this new position quicker.
Yes, sir.
It's called neuroplasticity. And movement is your friend, immobility is your enemy. If you're laying around too much or sitting around too much, this will probably get more stiff and sore. Doing your history and examination today, didn't see anything that concerned me about pathology, so I think you're just subluxating, can be adjusted a couple times and you stabilize, and then once you do that, you just text Renee when you want to come back in for a tune-up.
Yes, sir.
Does that sound okay to you?
Yes, sir. Great
Well,
meeting
welcome
you.
to Advanced Chiropractic Relief.
Thank you. Ring the bell.
Yeah, oh yeah, if you felt that all the way down, you can ring the bell. There you go.